This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
It can be detected in early pregnancy, right at birth, or even in the early years of a baby's life. But once birth defects manifest, they can cause a myriad of problems for both the child and the parents.
Birth defects are fault in the phases that you can see, metabolic, that can be seen at birth. If you look at the congenital anomalies, it will range from very simple kuntil dito or skin tag to the most serious one, like the congenital heart diseases, and then the meningomyelocele, yung mga bukol na nandito, or meningocele na nasa likod ng bata.
Some babies may have various health concerns, such as a malformed or missing body part. Some may develop a congenital dislocated hip, heart defect, and club foot.
The birth defect is very common in the Philippines. Actually, it's top 20 of the common causes of morbidity of all the births in the country.
In the Philippines, cleft lip and palates are some of the most common birth defects. In fact, 1 in every 500 babies is born with a cleft lip, palate, or both each year, making it one of the top birth defects in the country according to the Philippine Birth Defect Registry. There are many known causes of birth defects, such as genetic makeup, problems with chromosomes, and other environmental factors, but in reality, most cases are those that involve two healthy parents with no current health condition or risk factors. How common are birth defects in the Philippines? What are the most common birth defects in the country? How can birth defects be prevented? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Carmencita Padilla of the University of the Philippines College of Medicine and a pediatrician from the St. Luke's Medical Center and Medical City. You may join the discussion by calling our hotline at 548-4678. Good evening, Doctor. Welcome to MedTalk.
Good evening.
Birth defects. How common, Doc, are birth defects? Are you born with it, or does it develop during a certain period of one's life?
Globally, it's about 1 in 28. It's really common because you have the mild ones, the minor ones, and then you have the severe ones. Mm-hmm. Most of the birth defects, we don't even know we have them. So it's possible that we may have something we're not even aware of.
Okay, so is this genetic? Is it congenital?
When you say birth defect, it was present at birth.
Okay.
But it's possible it was not visible at birth. It's possible that it was only picked up much later in life. Mm-hmm. When you say defect, it's a defect. Defecto. Mm-hmm. Okay? So it's been there. But they don't have to be obvious from day one.
Okay, this is upon during the birth process, no? That it has to be obvious during day one.
Yun ang structural. Okay. When you have a physical defect like cleft lip and palate, you can see that from birth. Mm-mm. What about a heart problem?
Yes.
It's possible you did not listen to the heart and you did not pick up that there was a problem with the heart, but was picked up much later in life. That's also birth defect.
Yes.
Okay, so pag birth defect, it's anywhere from day one to much later in life.
So when these birth defects are detected or diagnosed, let's talk about genetics. What role does it play in birth defects?
Well, there are certain conditions that are due to the genes of the person. Okay. When you talk about birth defects because of chromosomal syndromes, that's when it actually happened while the baby was being developed. So chromosomes are the factories of the person.
Right.
So that means it's been there, and it's very obvious and physically obvious to the eye, naked eye, of the physician or even the parents.
So it's been there, those chromosomes that will result in a birth defect. Chromosomes from the parents, either the mom.
So let's just talk about that a little. So
yes,
the
please.
chromosomes are the factories of the body.
Yes.
So every person has trillions of cells. Every cell has the chromosomes. Every person, human person, has 46. There should be nothing missing, nothing extra. Now, sometimes you have 47 or 48. That is a birth defect, and it can have obvious physical findings at birth.
Okay.
Now, sometimes the birth defect doesn't have any defect in the chromosomes, but actually inside the genes that are found inside the chromosomes. For example, hypertension, actually, if you think about it, is found in the genes. But when the baby is born, you don't see it, and you probably will manifest much later in life.
Yes.
Diabetes is could be partly caused by the genes, but diabetes is complicated because it's multifactorial, but the thing is, it's found in the genes. So pag sinabi natin genes, it's in your factory to start with.
Okay. So does it necessarily mean it's from the parents, the mom or the dad, or can it start from the baby? Can the defect start from the baby, that chromosome?
It is possible that the parents were normal.
Okay.
But during the pregnancy, something happened to the baby.
Okay.
So the first 3 months of life inside the mother, the baby is developing, the brain, the heart, all organs. If something happens to the mother gets sick, or the mother gets exposed to something that's bad for the baby, we can have a problem. So it is possible that it's only found on the baby. And majority of the birth defects do not have any explanation. The parents don't have them. So it is possible that it's only starting with the baby.
With the baby. But you've mentioned that, for example, the mother gets sick during pregnancy. Does that necessarily mean it's congenital?
Okay, so when you say congenital, it's found at birth. So let's give a very let's give an example.
Yes.
German measles. Okay, German measles. If the mother did not receive any immunization and actually had German measles during the pregnancy, there's such a thing as a rubella syndrome.
Okay.
So ibig sabihin nun, the mother may not have any signs and symptoms, but when the baby is born, the baby has many birth defects.
Because of that?
Because of the exposure
measles.
to German measles.
Okay. So let's talk a little bit about the exposure of a pregnant lady to German measles. Is it crucial? What are the most crucial trimesters? First trimester, second trimester, third trimester?
First, the most crucial is your first trimester because all the organs are developing. And that is the time when you don't know that you're pregnant.
Yes.
Okay. So that's why it's very important to plan the pregnancy because you never know what's going to come out.
In the event that you're not able to plan the pregnancy.
Well, yes. The pregnancy has to be planned so that you can prepare and make sure that you do not get exposed to sick people or you don't visit a patient in the hospital so that you can protect your baby.
And in protecting your baby also, it's sometimes hindi maiiwasan that you get sick. Like you've mentioned, German measles or maybe chickenpox.
Yeah, that's right.
And that can contribute to a birth defect.
That's right.
How about during the birth process? Can a birth defect happen during the birth process?
This time, it's not structural. It's not the one that's physical, obvious to the naked eye. If, let's say, it was a very difficult delivery to the point that the baby did not have enough oxygen. To the brain, then of course there is some damage to the brain. Then this time, it's probably a developmental defect that will come out. So you have physical defects that you can see with your naked eye, and there are other defects that are not obvious to the eye.
Okay.
And so for instance, yung sa newborn screening, all of those babies are normal. So you will not see anything. The babies look normal. But still, there is a problem inside the baby.
Okay, and you only detect that as the baby is growing, or how?
For the baby who had a difficult delivery, it is possible that you will not see it even when the baby is discharged, but if the development is going to be affected. For the defects that are due to genetic problems that can be tested with newborn screening, you can pick that up when you do the test at birth.
Okay.
And then the baby can be treated immediately so that you can reverse the complication.
How about the ultrasound, like the 4D ultrasound? Can it detect birth defects?
The ultrasound will pick up a physical defect.
Okay.
As a matter of fact, sometimes it can be missed because it depends on the position of the baby.
Yes.
But it can pick up major physical defects, and this will alert the doctor to probably bring the mother to a hospital that can take care of the baby upon delivery. Because sometimes it's the delivery can be so complicated and they need an intensive care unit upon delivery.
So the care that will be given to the baby is already upon delivery, not while in the womb, not while it's detected.
In some cases, yes. So sometimes the mother looks healthy and well, but when they did the ultrasound, they found a birth defect that warrants immediate surgery upon delivery of the baby. You would rather transport the baby inside the womb of the mother rather than transporting the baby with a problem.
Okay.
And that's the reason why sometimes you want to bring you want the mother to deliver in a hospital with facilities because the baby needs special care.
Before we cut to a break, doctor, is that detecting a birth defect in the womb cause for an emergency C-section?
No, definitely not. There are many factors for that one, but there are many babies with birth defects who are born in the normal way. So I don't think that should be an issue. There are many other factors for making that decision.
Doctor will talk more about birth defects. You'll enlighten us all the more about these birth defects, risk factors, and you mentioned newborn screening. We'll talk about that also when MedTalk returns.
According to the World Health Organization, global issues in birth defect prevention, folic acid can effectively reduce the risk of having clefts in newborns.
We're back here on MedTalk, still talking about birth defects. Dr. Padilla, what are the most common birth defects?
You know, in the Philippines, it's still cleft lip and palate. It's 1 in 500. Relatively more common than the rest of the world.
Okay. Why is that? And why cleft lip and palate? And why here in the Philippines?
Well, actually, we're trying to study that right now, trying to find an explanation. But we don't have the clear-cut explanation for that, but we know that in the Philippines, the incidence is very high. Most of these are not hereditary. It's isolated birth defects.
Okay, so not hereditary. Genetics doesn't have anything to do with it?
Pag sinabi mo kasing genes, syempre yung genes mo, nandoon it could be a problem. But when we're saying hereditary, hindi siya 2 generation, hindi siya 3 generation. Isolated lang siya. Siya lang ang merong cleft lip and palate sa pamilya.
So, magsa-start with the baby, kumbaga.
Well, siya lang. Pwedeng siya lang talaga. It's not even something that will be passed on. It's an isolated case of cleft lip and palate. And we have many cases in the Philippines.
Could it be congenital upon during childbirth? Nagpo-forceps pa ba, Doc?
Meron naman, pero hindi ito nakukuha sa forceps because ang cleft lip and palate, nangyayari yan anywhere from about the first 2 months of development. Pag kaya ka nagkaroon ng cleft lip kasi hindi nabuo yung lip mo, and then the same with the cleft palate, hindi nabuo yung roof ng mouth mo. So this happened very early in the game. So that means way before you even thought or realized that you're pregnant.
Okay.
So pag nag-forceps ka kasi, ano na yun nandiyan na yung bata.
Oo about to come out na yung bata. So you're saying nasa tiyan pa lang?
Oh, yes.
Upon conception pa lang, possibly?
Conception hindi naman. Conception, that's a different story. Pag sinabi yung conception naman ngayon, ito naman yung mga major chromosomal abnormalities na talagang practically at conception nagka-problem ka. Pero pag cleft lip and palate, you're looking at the first 2 months of life. Mga 6 to 9 months. Mga 2 months.
2 months pa lang.
2 months, 8 to 9 weeks.
Okay, parang first time.
Yes, first time.
So, is there something that the supplements a mother can take para maiwasan to and in other birth defects in the future?
Alam mo, there are many things you cannot prevent. There are many things you have no control of. But there is one thing that you can avoid or you can prevent, and those are the neural tube defects. Nakikita niyo yung sa TV, may bukol dito, may bukol sa likod, or let's say walang brain, anencephaly. That can be prevented 60% of the time by with the mother taking folic acid weeks before pregnancy.
Okay. So this is because it's a planned pregnancy.
Yes, kaya ang recommendation talaga all around the world is that any woman in the reproductive age must be taking folic acid at a dose of 400 micrograms per day, 400 micrograms per day. And you have to take it long before you get pregnant.
So part of your daily supplement, ang folic acid?
Tingnan mo na lang vitamina mo. Make sure na meron kang 400. The husband can take a vitamin with only 50 or 100, but the woman needs that 400 micrograms to protect the baby in the future. There are reports saying that folic acid can also prevent cleft lip and palate, but there's still a lot of study ongoing right now to prove that. But my recommendation to the audience is if you're sexually active in the reproductive age, you must be taking your folic acid every day. In the States, when they say take the pill, they're talking about the folic acid pill.
What role does folic acid play in a woman's body
in
relation to pregnancy and the development of the baby?
It's basically it's been proven to prevent the development of these problems. Itong tinatawag yung neural tube defects, no? Kasi yung development ng neural tube mo, eventually magiging brain mo, it needs that. And that has been proven already. Scientifically based na yun.
Okay. So talagang you have to, it's a must. Prior to conception.
Prior to conception. Weeks before, hindi pwedeng, you're gonna get pregnant next week. Sasabihin mo ngayon, inom ka, no? That's too late. You really will have to take it weeks before or months before.
Kunyari, you find out you're pregnant, you start taking it.
It's too late. It's too late.
Okay, so prevention.
And in the Philippines, we have the data. It's very common. In the top 10, nasa top 10 pa rin namin ang neural tube defects. Nasa top 10 namin siya. Nakakalungkot dahil pwede mo siyang maiwasan 60% of the time. So we're trying to, together with the Department of Health now, we're trying to get enough data so that we can push for the provision of this vitamin to all women. And second, to include it in the education of the girls and the women. If government will not provide the vitamin, what I'm hoping is that there will be a campaign telling every woman that they have to take the folic acid.
And then this is the campaign. This is telling every woman to take their folic acid.
That's right.
Any other supplement that
yun ang pinaka-critical na talaga. We're talking about birth defects, that's it.
Yes. Okay. So that can, what percentage
about
can?
60% of the time.
Wow.
Yeah, malaki yun. And we have many cases in the Philippines. Nakakalungkot. Pag nagkaroon ka ng isang batang may neural tube defect, pag nagbuntis ka ulit, your dose should be 10 times. Okay. So instead of 400, 4,000 ka na.
So you mentioned neural tube defect.
So
ito ba nakaka-lead sa cerebral palsy? Does it lead to other mental disorders?
Ang neural tube defect kasi, ang extreme mo talaga is your anencephaly, no? Yung nakikita natin, anything along the spine and the brain that's affected. So may range din siya, no? It's a development. It's important to the development of the neural tube, but eventually becomes the spine and the brain.
Yes. Tests and diagnosis, doctor. We talked about German measles earlier. That if a mother contracts German measles during her pregnancy, it's very crucial for the development of the baby. May tests ba that they can get amniotic fluid from the baby to test? Kung
No,
naapektuhan siya?
actually, pregnant women don't even know they had a German measles. It's so fleeting, no? Parang hindi mo man lang napansin.
Okay.
Lalabas lang yan pag pinanganak ang bata, nakikita mo na yung kanya mga problems, yung maliit ang ulo, yung may problema sa puso, all the physical signs of what you call the rubella syndrome. So, it becomes very obvious when the baby is born. And then you interview the mother, nung buntis ka ba? Nagkasakit ka ba? And then you find out indirectly. So, my recommendation to the mothers is that it should be a planned pregnancy. They should consult their obstetrician and then, or their midwife, find out how to plan, because you want to make sure that you're covered. Okay.
So, German measles and chickenpox to the most
Yun ang pinaka-common pa rin. Yun pa rin. Yung meron tayong tinatawag na fetal alcohol, though honestly in the Philippines, I have not really seen that many as compared to Africa. The people who drink a lot. Okay? May tinatawag kasing fetal alcohol syndrome, wherein there are very specific findings on the baby. Smoking can also have some problems on the baby. Usually they're small, may problems din naman. So I think the important thing is that if you're going to get pregnant, you really want a healthy lifestyle way before you decide to get pregnant.
And just in case na you get German measles or chickenpox, the baby, the amniotic fluid from the placenta, can that, diba?
Well,
para lang you're kampante ka that you know.
Well, if just in case you suspect, what will happen is that you discuss it with your obstetrician, they might run some tests, but I don't want you to be panicking throughout the pregnancy. And then for all you know, chickenpox, nakikita natin yun, no? Kasi very physical yun kung magkaroon ka. Pero yung German measles, pwedeng hindi malalaman ng mother na nagkaroon siya ng German measles.
Okay.
It's very possible. So we have to be careful when we're pregnant.
Okay. And in being careful when we're pregnant, we also have to be careful of the baby during newborn screening. When we request for newborn screening, we must have newborn screening. I understand not all birth defects are detected by newborn screening.
So ang physical defect, maski hindi ka mag-newborn screening, makikita mo yon. Okay? Pag yung newborn screening, you are looking at problems that cannot be seen by the naked eye naman. That means you have a healthy looking baby, but you run the test because the test will tell you whether the baby has a problem or no problem. Okay. So right now we're screening for 6 conditions. So ano ibig sabihin nun? Yung isang condition to, yung tinatawag nating congenital hypothyroidism. Okay. The baby looks normal.
Yes.
But if you don't start treating by the 2nd or the 3rd week, you don't give the missing hormone, the baby starts losing an IQ point.
And this is diagnosed upon newborn screening, hypothyroidism.
Yes. Okay. Yung congenital adrenal hyperplasia, they can be dead by 1 week. Okay. Yung phenylketonuria, they can start losing IQ points by 3 weeks, but you have to change the milk.
How about hearing disability, eyesight?
Well, yung hearing, meron tayong tinatawag na newborn hearing screening naman. And actually, we do have a law also for newborn hearing screening. And I really encourage everybody to have the babies undergo newborn hearing screening. So meron tayong newborn screening, which is a blood test. And then you have the newborn hearing screening. That's for the hearing test.
Okay. Sa APGAR test, when the baby is born, is there a birth defect that can be detected with your APGAR score?
Iba naman ang APGAR score, no? It's basically it's telling us, giving us a number so that we know how aggressive you are with taking care of the baby. Iba naman yon. Hindi mo pipick up doon.
Hindi mo pipick up. So talagang newborn screening. I also understand na updated na ngayon ang newborn screening. Before 6 disorders lang ang madedetect now.
Yes, today lumabas na sa dyaryo, no? Lumabas na, we're expanding it from 6 diseases to 6 conditions to 28. So, ang ibig sabihin lang nito, we are able to screen for an additional set of conditions, and that means we can save the baby. Kasi hindi mo nga makikita, all these babies look normal. Okay? Pag hindi mo tinest, they will have the problems.
So, how does the test work? How soon after do you get the results? And what do you do upon receiving the results?
You want to do the test after 24 hours. Okay? It's a prick at the sole of the foot, sa sakong ng bata. It goes to one of the 5 labs, so you don't have to bring the baby to the lab. There are only 5 labs in the country. All 5,800 hospitals now are offering it. And you should be getting, if the result is positive, screen, you should be getting a result within the first 5 days of life. And then you'll be called by the hospital.
Okay. So every mother should, or every newborn baby rather, should
But
have
every
this.
newborn, yes.
Every
yes.
newborn. No?
Every newborn. Right now, we're only covering 60% eh. Ang coverage natin ngayon sa Pilipinas, I think at the end of this year is roughly about 60%. So may 40% pa kaming hindi nakaka-capture, and most of them actually are home deliveries. And my message to the parents is that napakahirap mag-alaga ng batang retarded. If only you know that you can save it, then of course you will ask for newborn screening. Marami po tayo dito sa Pilipinas na hindi naaagapan ng newborn screening. So the goal really is for all of the babies to be screened so that we're able to identify those who need treatment at birth.
So all hospitals...
right now, it's part of licensing, so they have to offer it.
Okay. Okay, and they have to offer it. But what if the parent, for example, like, you know, the cost?
Well, it's covered by PhilHealth if you're a member. So, ang kinakampaign ko nga ay be a member of PhilHealth. Okay? Para dun sa 6 diseases, it's $550 and it's covered by PhilHealth. Itong bagong labas nating 28 diseases, so far, $550 lang ang covered. But then, you have to think of the cost of caring for a special child. Okay? The treatment is... the treatment for congenital hypothyroidism is very cheap. Okay. The treatment for some of the conditions, lalo na yung mga milk formula, are expensive, but it's covered by, we have somebody giving the milk and it's covered. Those expanded newborn screening, it's covered by the program.
How about cleft lip, palate, and those with other birth defects?
Well, yung birth defects, ang treatment kasi, kung pupunta kayo sa government hospital, of course you don't have to pay for the hospitalization in the doctor.
But is it an immediate medical procedure?
Okay. Merong mga birth defects na kailangan kaagad operahan. Okay?
Kapag panganak pa lang?
Merong ganon. Karamihan, hindi kailangang operahan kaagad.
Okay.
Pero ang importante, dapat makita siya ng spesyalista para maplano ang schedule kung ooperahan.
Okay.
Hindi lahat ng birth defects inoperahan. A good example is actually the heart. Hindi lahat ng problema sa puso, pag sinabi mong congenital heart disease, inooperahan. Yung iba walang gamot. Yung iba may gamot.
Okay.
Yung iba naman kailangan operahan.
Right.
So ang importante, dapat magpatingin para malaman kung anong gagawin sa bata.
Okay. So importante magpatingin para alam ang gagawin sa bata. Importante din that the mother is healthy during her pregnancy.
Dapat.
We'll talk about that,
yes,
doctor.
Yes.
And more about birth defects when MedTalk returns. We're back here on MedTalk, still talking about birth defects. You may join in the discussion by calling our hotline at 548-4678. Dr. Padilla, we talked about cleft lip and palate. We talked about congenital heart. How about club foot, which is also a common birth defect?
Yeah. Yung club foot, basically yung paa, imbis na tuwid, naka-incurve siya, no?
Okay.
It's, yung cause pa rin niya, unknown din. So, marami talagang birth defects na hindi mo alam talagang dahilan na anyway. So, yung iba, papanganak ng may isang paa na medyo nakaliko. Yung sa iba naman, dalawa. Ang message talaga dito, dapat to napapating ng kaagad kasi gumagawa sila ng serial casting para bang ini-straighten nila talaga yung legs to the point na yung pwede siyang matuwid. Okay. Merong iba naman dahil sobrang serious na nung kanyang club foot na at one point mag-oopera. So hanggat maaari, you're avoiding actually a surgical procedure.
Right.
So wag sila matakot pag pinanganak ang bata, lalo na sa bahay. Kasi pag sa ospital to, mare-refer na ito eh. Pero lalo na yung mga nasa bahay na pinapanganak, pag nakaganon ng paa, dali na sa center, dalhin sa ospital para ma-refer sa orthopedic surgeon. Tapos magsi-serial casting lang yon.
Okay,
Tapos
so
hanggang
matutuwid and makakalakad
tutuwid.
ng tuwid.
Well, ang goal
the
natin
baby.
kasi sa kanila, makalakad ng maayos.
Okay.
Kung kakayanin ng hindi operahan, that's good. Pero
Right.
yung iba na operahan, pero at least hindi na natuwid mo na ng konti.
Is it genetic? Congenital?
Alam mo, karamihan pa rin. Kung in isolation siya, ganito lagi, pag may birth defect ka, ang tanong isolated ba siya o hindi?
Okay.
Kung isolated siya, mukha talagang, yun lang, wala nang iba. Yung iba kasi, meron pang kasamang ibang birth defects. Yun ang nagiging syndrome. O, hindi ko na i-discuss yun, pero merong mga conditions na 10 ang birth defects niya. Tapos meron siyang, Down syndrome is one. That means marami kang makikita at ang tawag sa kanya ay syndrome na.
Okay, so you mentioned Down syndrome in relation to clubfoot na merong isang individual baby na may 10 birth defects.
Ang Down syndrome naman kasi, ang problem nito ay yung kanyang chromosomes, yung sinasabi kong factory kanina, dapat 46 lang. Sa Down syndrome, may sobrang isa, 47. At ang sobra niya, yung number 21.
Okay.
So, kapag may Down syndrome ka, laging 21 ang sobra. Kaya maski pa magkakaibang lahat ng batang may Down syndrome, magkakahawig sila kasi pareho yung error.
The 21
So, pag
chromosome.
sinabi mo ngayong naghahanap ka ng 10 bagay, mata, yung kanilang facial structure, okay? Yung tone ng bata, relatively, hindi siya, yung tone niya, mas malambot siya pagkapanganak. May hinahanap kami sa kamay, sa daliri. Marami kami hinahanap eh.
Okay.
So, pag nakita mo yung bata, sasabihin mo na, ay, itong batang ito ay malamang may Down syndrome, magpapagawa ka ngayon ng test na tinatawag na chromosome test.
Nakikita ba yan sa newborn screening?
Hindi. Ibang test ang ginagawa dito. It's called the chromosomal study. It's a chromosome test.
Okay.
So ang Down syndrome, nakikita mo physical yun, nakikita mo siya. And then yung i-confirm mo lang using a blood test called the chromosome test.
Okay. So when is it recommended that you get a chromosome test, and when do you get it?
Well, ang recommendation ko, if you can do it at the earliest possible time, you want to do it. Okay? Kasi tatlong klase kasi ang Down syndrome eh. And kung bata pa ang couple, ayoko silang nagwo-worry. Karamihan pa rin dito aksidente.
Okay.
Para yung couple, makapagplano sila nung next pregnancy nila. At ang isa pang message sa Down syndrome, it's still associated with advanced maternal age. That means anybody can have a baby with Down syndrome, pero advanced maternal age, 35, beyond that, pataas na ang risk.
Okay, na you will have
risk
a
lang,
baby.
pero maraming nanay na 45 at 48 na normal ang kanilang anak. So it's not,
true. So age is a risk factor?
Age is a risk factor for Down syndrome.
Okay.
Yung ibang syndrome, tatay naman.
Okay,
Nagkataon
like what?
lang maraming syndrome sa tatay naman ang issue. Pero since ang pinaka-common Down syndrome, it's the advanced maternal age na ano natin. And there's so much we can do for them now. Meron tayong Down Syndrome Association for the Philippines.
Yes.
It's an association of parents wherein they help the other parents take care of the children.
How about taking over-the-counter medication without the advice of your OB-gynecologist? Is it a risk factor for birth defects?
Well, hanggat maaari ayaw mo talaga ng over-the-counter medicine, lalo na kung buntis ka, dahil may mga gamot na hindi safe sa bata. Okay? So, kapag nakainom ka ng gamot na hindi pala maigi para sa bata, pwede magkaroon ng effect sa bata yon. So all the more, pag buntis ka, ayaw mo basta uminom ng gamot. Bakit ka magtatanong sa doktor? Kasi alam ng doktor kung anong safe sa baby. Because some drugs are safe for babies. Ayaw nating may sakit din yung nanay. But the doctor will prescribe a medication that is safe for the fetus.
Kasi hindi mo rin maiwasan that when you're pregnant, you may have a fever, you may have a headache, you may have, there's another person inside of you. So, a lot of things happening, no?
You cannot be sick because it will also affect the baby. Ang importante mag-consult.
How about falling? Sinasabi nila, pag
falling.
nadulas ka, it can have an effect on the baby. Is that true?
Alam mo, pag nadulas ka at your 8th month, nabuo na yung bata. Okay. Kasi di ba ang pinaka-common nating naririnig, kaya merong hiwa sa labi kasi nga nahulog o kaya nadulas. Hindi, that's not true.
Doctor, how can a prospective mother have a healthy and safe pregnancy?
Well, number one, siguro it's planning the pregnancy. That's number one. Number two, avoid the vices. Kasi lahat ng vices, from drugs to alcohol to smoking and unnecessary medications, can have effects on the baby. Number 3, healthy living. Okay. Number 4, take your folic acid. Okay. So you have to take care of your body because it's the one that will take care of, that will carry the baby. Okay. And if you take care of your body and of yourself, of course, that's one way already of ensuring that the environment for the baby is going to be healthy.
Every step of the way, are there pointers or reminders, like on your first trimester, second, and third trimester, Doc?
It should be a healthy pregnancy. Okay. If you're pregnant, you don't want to go to hospitals and, you know, lalo na pag first trimester
expose yourself to smoke.
To unnecessary. O passive smoking is as bad as active smoking. If your husband is smoking, pareho lang epekto nun nang ikaw nag-i-smoke. Maybe for the pregnant woman, it's a healthy pregnancy. Pero pag pinanganak ng bata, ang dapat tandaan yung newborn screening at saka yung newborn hearing screening, because we can reverse mental retardation, we can reverse death. And then for hearing naman, we can help the child and make sure that the baby can hear, because that's important also for speech. So I think every step of the way, it's going to be very important.
And consultation with your doctor, no? Every step of the way, not to self-medicate as well.
Oh, hindi talaga dapat nagsa-self-medicate, and as much as possible, you want to consult. Okay. So wala namang mawawala. Nandiyan naman ang health center para matulungan sila.
At yun ang ginawa natin tonight, Doctor, to consult with you on how to have a healthy and happy and safe pregnancy. Thank you very much, Dr. Padilla.
Thank you.
We'll talk more about birth defects when MedTalk returns.
According to a study made by Dr. Carmencita Padilla and her team, rubella was discovered to cause birth defects in the 1960s, and that mothers using thalidomide caused an epidemic of limb reduction defects.
We're back here on MedTalk. This time we have with us Dr. Alejandro Diaz, an associate professor of the Department of Neurology and Psychiatry at the University of Santo Tomas. He's here to tell us how we can prevent vitamin D deficiency that affects pregnant women. Hi, Doc. Welcome to MedTalk.
Angel. Good evening. Yes.
Vitamin D. Why is it important for a pregnant lady to take vitamin D?
Yeah, I think it's not only for pregnant lady. Everyone should be checking that they ensure themselves to have optimal vitamin D level. It's because it was only recently, in the past few years, that the normal level of vitamin D has been put up by those experts, the authorities, that it should be the normal. Now they have changed it to they doubled. In the past, it used to be between 8 to 15 nanograms per ml. That is normal. But in the recent past, it has become 20. And now it's 30. And now, to be optimal, they said it should be 40. And there are some experts that actually are pushing it to be at least 50 nanograms per ml.
Okay.
So they thought that in the past, they thought that it was only bone health that was important.
Yes.
But with the recent researches, there are so many researchers now that shows that it is important from childhood to even adulthood and to the elderly. And it is now being associated with so many diseases. So I think, as Professor Michael Holick said, it's probably the most common medical condition in the world today.
What are some of the medical conditions that arise because of vitamin D deficiency?
Unlike before, that we used to just believe that it's been associated with bone diseases like osteoporosis, osteomalacia. Now, increasingly, there are more and more evidences that it's being associated with chronic diseases such as autoimmune diseases, some certain neurological and psychiatric conditions such as multiple sclerosis, dementia, depression.
Wow.
Okay. Also in cardiovascular diseases, there seems to be increasing number of association with hypertension, cardiovascular disease, also infections and malignancy. And the reason for this, it has been recently because of the Human Genome Project, you know, the epigenomics, that we're able to discover now that vitamin D actually is not just an ordinary vitamin. You know, vitamin means it has to be produced outside. It's not produced in our body, and we have to get it.
Yes.
But vitamin D is something that can be produced inside our body through the sun exposure.
Yes, sunlight. You mentioned, no, as
That's
a
right.
child, from childhood, you need your vitamin D. That's why, as
That's
a baby,
right.
you're
Yeah.
exposed to
Yeah.
sunlight at certain times of the
Yes,
day.
yes. And the baby, you know, if, you know, coming from the breastfeeding, the most advised, most of the mothers are vitamin D deficient, so they cannot get it enough from milk itself. The recent studies now is that even the fortified foods, milk, is not enough. They do not reach the therapeutic, therapeutic level of vitamin D that should put the vitamin D level at optimal health level.
Okay, so you can't, it's not enough to get it from sunlight?
The best way to get it is through the sun.
Through the sun.
If one can really go out.
You have to make time to go out and expose yourself,
The best time of the day is most of us don't have time to get out because most of us are indoor during that time, which is during the middle of the day. So in the Philippines, you are just a little more about north of latitude of the equator, maybe between 9 to 4 p.m.
So that's the good sign.
Yes,
that's
but
where
if
you
you
get
are
your
living
vitamin
up
D
north
from.
there, it's between 10 to 3 p.m.
Okay.
10 a.m. to 3 p.m. And the best way to ascertain that is check your shadow. When you're out there, check your shadow, that your shadow should be at least as tall as you or shorter than you. Not long, because the UV,
there are guidelines
because the ultraviolet B rays is deflected, cannot interact with your cholesterol in your skin to make the vitamin D that will still be converted in the liver and the lung to become the hormone, the corticosteroid.
The hormone that you need.
125 dihydroxyvitamin D, which now acts on the different cells. And recently, it has also been discovered that in the DNA, there is a part there where the activated vitamin D attaches through the vitamin D receptors. And this upregulates up to almost 300 genes that has been discovered recently. And this modulates, regulates most of the cellular processes and metabolism in our body.
Okay, so this is, well, the best source, if from your explanation, is the sun. But
the best source is the sun. You can, the foods that we eat is not enough.
So the sun, if we're not able to get sunlight, we're not able to expose ourselves to the sun, we're not able to eat the right amount or the right type of food for vitamin D. What other sources can give us that vitamin D requirement that
yes, in the northern hemisphere, they advise to be subjected to a tanning bed, but we don't have that tanning bed. So in other areas, supplementation with vitamin D is advised. Okay. Also, there are many other factors that one can become deficient. The skin type. Okay. The darker the skin, the harder for the skin to make vitamin D. Also, the weight. The more obese, the fat becomes like a sink. So they need more vitamin D to have a circulating vitamin D.
Okay.
Age also, 50 and above, it's harder not to make vitamin D.
Okay.
And of course, the pollution, the time of the day, the clothing, the use of sunscreen, all of those can actually reduce that. So in fact, I think...
How about, Doc, let me cut you for a while. How about age, gender, rather? Are women more deficient than men? Do women need it more? Yeah,
in a local study here in the Philippines, it has been shown that women are at least 20% more deficient than male. If the males were 60% deficient in selected normal working people in the different cities in the Philippines, the women part were about 80%.
Oh, wow. So talagang we must have vitamin D
and this is very,
supplements
we must understand that because of the, in the past, the vitamin D assay is very expensive. Now, because of the wide use, it has become inexpensive. It's now available here in the Philippines. So we are able to check, and in fact, in the local study in different cities in the Philippines, about 5,000 of them sampled. about 70 to 75% were found to be deficient or insufficient.
Okay.
And that's hard to understand before because we're living in an equatorial, so we're supposed to be living, you know, in a temperate country. So why is that? Okay.
And in a tropical country, you know, where vitamin D is readily available, and we're still deficient
and
with
the
that
simple
vitamin.
reason is that we don't get enough sun exposure.
Okay.
And of course, of the sun scare, many things, you know, of the, you know, especially women who take something that makes them, Filipinos like to be whiter.
Yes, yes. There's
So
that
that's the reason.
thinking, no, that the Filipinas, as you've mentioned, no, would like to be whiter. But, you know, in wanting to be whiter as well, you can still get your dose of vitamin D.
Yes. It is advised that a moderate, short, sensible sun exposure, which is around 5 to 10 minutes for an average adult, no? In the middle of the day, unprotected, no sun, no sunscreen, is enough.
Okay.
It's enough. Yes.
All right.
And the reason why, but different times of the year. For example, during cold seasons, December na tayo ngayon, January, February, our vitamin D status level goes down.
Okay.
That is why in other countries, depression, suicide goes up during that time because the vitamin D is so important also in the production of serotonin, which makes us happy. Correct. Okay. So when you go out of the sun there also, it has been found out also that we thought before that the brain is the only organ that produces the beta endorphins, which is the happy hormone.
Yeah.
The skin actually makes beta endorphin
also.
likewise. That's why when you go out there in the sun, you bask in the sun, you feel good.
Yeah. You feel happy.
You feel happy.
And you get the right amount of vitamin D that your body needs to keep you healthy and strong.
Yeah.
No?
But unfortunately, as I said, when you get older, okay, the skin becomes thinner, and elderly people have 60 to 70% less ability to make vitamin D.
Okay.
So, and of course, they don't go out more. So they're really more prone to develop. In one study, about 80 to 95% were found to be deficient. Okay, so if we believe that vitamin D is not really just a vitamin, it's a hormone, it's a psychosteroids that impacts on the immune cells, cardiovascular, brain, nerve cells, and everything. So it somehow, if you are deficient in this, it somehow can put you at risk of developing this unnoticed as you grow older.
Okay, so it doesn't appear immediately, no? Some medical conditions don't appear immediately because of vitamin D deficiency.
But in one study in Finland, for example, in children, they supplemented a group of, group A supplemented with 2,000 international units of vitamin D, the other one non-placebo. And they followed this for 30 years. There was almost a 70% reduction of the type 1 autoimmune diabetes mellitus.
Okay, so you can get
this
diabetes.
Is an autoimmune disease.
Okay. So how will one know if you're deficient in vitamin D? Is there a test?
Okay.
Are there signs?
Okay. First, I'll talk about the clinical. Yeah, as I said, you don't have to be tested. Not everyone should be tested. But you know, if your skin is darker, you're probably deficient. If you are 50 and above, you're probably deficient. If you are, you know, on the fat side, you're probably deficient. If you are, you know, not exposing yourself to the sun, you're working indoors, you'll probably be deficient.
Okay.
If you're taking medications, okay, anti-epileptic drugs, anti-TB drugs, it actually lowers your vitamin D more. So. And then, of course, if you are like this and if you really want to be tested, ask your doctor. Many doctors now are aware that vitamin D assay is available. Okay. And as I said...
it's available in what type of form? What form?
But it's a blood test. It's called, we request a serum 25 vitamin D level. Or just put their vitamin D assay, and we're going to get the results. The normal should be 30.
Okay.
Okay. Below 30 is insufficient. Below 20 is deficient. But we don't want people to just be on the normal, the average, because as I said, it fluctuates. Yeah, the highest point of our vitamin D is during summertime, and the lowest is during
this period, this time.
That's right.
Christmas.
So the advice now, the recommendation is put it at the optimal level. And there's a study, the Nurses Health study in the U.S., that they saw now that it seems to be associated with breast cancer. That they saw that
vitamin D deficiency,
right? Because they saw now that at 48 nanograms, it becomes protective. Those at the lowest level have the highest level of breast cancer in that study. So there are now some experts that put it there that maybe the protective effect of vitamin D for breast cancer is at 50 nanograms.
Okay,
So maybe to make it easier to remember, at 50.
50.
Anyway, the toxic level is so high. It's at around 150 nanograms per ml. And our body cannot be toxic if we expose ourselves the whole day in the sun. Hindi pa pwede.
Iba
Kasi
naman, you might get skin cancer if you expose
Okay, there's a controversy with regards to that because, well, first is we don't want to expose ourselves too long, actually. But the studies now have shown that there's no substantial evidence that it increases really the melanoma type, the deadly type of the it increases the basal cell carcinoma and the other non-melanoma types of cancer. But our advice is actually not to expose too long. It's just short.
The 5 to 10 minutes.
That's right. Or about if you measure how long does it take for your skin to become erythematous or pinkish, and take 1/4 of that. So if it takes 40 minutes, then just 10 minutes is enough.
10 minutes is enough.
If it takes 20 minutes, pabumula ka na, just take 5 minutes. That's enough.
So what is enough, before we go, doctor, how much vitamin D should we take if we're not able to get it from the sun or from food sources?
The recommendation is 800 to 1,000 units a day.
Okay.
As I said, we can never get it enough from food because you have to take, say, 20 eggs a day.
20 eggs a day?
Yes, okay, and 8 glasses of milk a day, or a
We
lot
can't really
of tuna
do that
fish,
in one day.
mackerel. We cannot do that,
can't
actually.
do that, yes.
That's too expensive. So what we advise that the available pure vitamin D supplement is available in the market.
Okay. That we can do,
but
that
also,
is available.
I also must recommend also that in adults, especially in the elderly, they should be taking also calcium. Okay. But the calcium should be at a maximum only about 1,200 milligrams per day.
So these recommendations for vitamin D, and you've mentioned calcium, they should be given by your doctor? They should be prescribed by a doctor, or can you take them over the counter?
Actually, you can take it. But if you have some condition, like for example, your memory is failing, for example, one of the things that they've seen, by the way, in the elderly, that those in the lowest level of vitamin D seems to be, their mental function is not that good. And when they check that and when they improve that, their depression got better, their mental function got better.
Okay.
Okay.
So,
and there's now even a journal article in the recent August 2014 that dementia, the Alzheimer's type and the non-Alzheimer's type seems to be associated with the lowest vitamin D level as published in a Green Journal of Neurology in August 2014.
So, Doctor, thank you very much. Apologies, but we've run out of time. But you've given us so much information on why we should have why we should take vitamin D.
Yes.
Okay, thank you so much,
Thank
Dr. Alejandro. We'll see you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9 TV. This is Angel Jacob. Good night, everyone.